as a journalist, I go around picking stories, and I observed in the society that women were actually dying from pregnancy and child delivery related incidents. And the wake-up call for me was when a family friend of ours lost his wife when she was delivering. And that really shocked me because she was in a good hospital, and she was being attended to by doctors and nurses, and was receiving good health care, yet this lady passed on. So I started exploring and investigating just to find out if these ladies were able to afford health care could die and yet they're in a hospital, how much more the women in the village who do not have access to health care, and sometimes they don't even know they need to go and visit a hospital and they deliver at home. How much more do they need the information?
Kenya is challenged by the reality that it has not been able to reduce maternal mortality. From 1990 to 2013, basically the high maternal mortality rates have remained pretty much the same for Kenya. In fact, it lists amongst the top 10 countries in the world with the highest level of maternal mortality.
In this country, we lose over 5,500 mothers every year, a statistic too hard to take as normal in this age of development and 50 years of post-independence. These statistics indicate that we have lost 18 to 20 mothers. We will have lost 18 to 20 mothers by the end of today, which is equivalent to an 18-seater minibus with pregnant women crashing and killing the passengers every day.
I mean, this is simply unacceptable, because what that means is that we're losing a woman every 2 hours.
That statistic that we are hearing, that a woman dies in childbirth every 2 hours, it is a tragedy and it is totally unacceptable.
From the time you have your breakfast at 7 o'clock to your 10 o'clock cup of tea, we have lost 2 mothers.
I have demonstrated through the Beyond Zero campaign that public-private partnerships can go a long way in supporting the improvement of the health status of our women and children. Ladies and gentlemen, reducing maternal and child deaths requires concerted multi-sectoral investments. Hence, the other social determinants that we must address include education.
There are solutions to reducing maternal mortality rates from a social perspective. For example, the mothers need to be sensitized on the importance of attending clinics, antenatal clinics during pregnancy. This is because the traditional birth attendant is still very active in our society, and a lot of the women feel that the traditional birth attendant is kind and understanding, and so they prefer to go to the traditional birth attendant. But we're saying, is it possible for women can we push the agenda and make it easier for the women to deliver with the healthcare service, so that if there is any complication or emergency, the baby and the mother can be saved.
It is important for us to equally invest in increasing demand and utilization of health services by the community. As we improve the health-seeking behavior of the community, the health service provision must be ready to meet this increased demand.
We need to save our mothers, because the future of Africa is in the bellies of our mothers.
Look at my nails, you can't tell. My smile as well. For me, it's a blessing when you naka through class, school and periodic table. Muni na go change the period.